Did you know that gum disease is the primary cause of tooth loss? More than 70% of the teeth that are lost are because of gum disease or periodontitis. So, why do we have gum disease and what happens in gum disease? How do we prevent it? How can we take care of your teeth and gums? And why is it so important to take care of our gums to save our teeth and our mouth? Let's just peep into what is gum disease, what are the damages that this gum disease does. Do stay in till the end of the video because I'm going to tell you some very important information about what this gum disease, what all damages does it do, not just for your teeth but also for the other organs in your body, and how you can prevent gum disease. Basically, gum disease starts. One of the first common symptoms that anyone can know that they have a gum disease is bad breath or bad odor. Okay, so if someone has bad breath or bad odor, the main cause of bad breath or bad odor could be gum disease or gingivitis. So a swelling of your gums, a bacterial infection of your gums can be shown as bad breath as the first symptom. The second symptom for a gum disease is bleeding gums, redness of the gums, and pus, separation of the gums. Important symptom that you can see for gum disease is bleeding of gums, redness of gums, swelling in the gums, along with sometimes separation of the gums. In the third stage, you start having sensitivity of your teeth. The teeth start moving. There could be pain of your teeth, pain of your gums whenever you bite, whenever you brush, bleeding when you brush, bleeding when you eat. And this is the third stage, which is periodontitis. That is, the disease has gone from the gums to the bone supporting the teeth, and that is when this symptoms show up. The fourth stage or the last stage is when the teeth are shaky, and that is the time that we cannot save these teeth and the teeth have to be pulled out. So that is the reason these teeth can suddenly damage, and this is what could happen. So how does gum disease start? What happens? Well, if we don't brush our teeth correctly, or if there is food that is stuck between our teeth, over a period of time, this food, whatever is stuck between our teeth, can get mineralized and turn into tartar. So this tartar and the plaque, that is the thin white layer that is stuck on our teeth, the bacteria and the microorganisms both in this plaque and tartar, they can produce some acid, and they produce this acid that could damage our gums. The first time when this starts is when you start having slight swelling of your gums, redness of your gums, bleeding of your gums, bad odor. So at this stage only, if you could visit a dentist, we could just get a cleanup done and take care of this disease. Did you know that the gum disease could be so dangerous and so damaging that the bacteria in these gums could cause bacterial endocarditis? That means someone who has a congenital heart defect, and if their gums are not healthy and there is gum infection, this could actually lead to a small bacterial nut forming on the heart, which is called bacterial endocarditis, the outer surface of the heart layer where this bacteria goes and gets infected. Well, research has proven that the same bacteria that is there in your gums is the same bacteria that is found on the heart where this bacterial endocarditis happens. So someone who has a congenital heart defect is suggested that they get a prophylactic cleanup done, see that there is no gum disease before they go in for any surgery, or regularly keep getting their gums and teeth cleaned. Number two is this gum disease or the bacteria from the gums has shown in our studies, in a lot of studies that have been done, it has also shown that it could cause impotency, that is a decrease in sperm count, and could be one of the major causes for miscarriages also. So another important reason why you need to take care of your gums and protect yourself from a gum disease. Not just these two things, but it could also affect the kidneys, it could also affect the stomach, it could cause gastritis, it can cause kidney disease, and a lot of other systemic diseases including diabetes. So it's very important that you do not ignore gum disease, you do not ignore bad breath, and you visit your dentist whenever you feel you see any of these three symptoms: a bad breath, bleeding gums, or a separation or a swelling on your gums. Now, how do you treat this gum disease? Treating of gum disease starts by basic cleanup of the tartar that is stuck between your teeth, and once this tartar is cleaned up, then the gums normally get back to normal. Sometimes the patients who come to us are already in stage 2, where there is not just the gums that are involved, but also the bone below the gums that are involved. So this is a stage where it is called periodontitis. So in periodontitis, it happens that we not just have to clean up your gums, but we also have to clean up your bone and treat the bone and the gums together. Sometimes we do this using latest technology of using dental lasers. Sometimes we do deep curettage, root planing, and certain slow releasing agents into the gums to treat this disease. Another time when patients come to us is at a little more later stage, where the damage has gone and the bone has already resolved a little. So in this stage, we treat the gums by doing a small gum surgery. A lot of times we do regenerative therapy, where we do guided tissue regeneration. We do grafting of the bone and the soft tissue to cover up the gums once the gums are healed, cleaned, and then we treat this. A lot of people, what I've seen is another way that these gums could get damaged is in the initial stages of gum disease, they start using toothpicks, which can break, which can cause more infection and go and spread your infection more deeper into your gums. Number 2 is people who are having habits of chewing tobacco, pan, gutka. They all end up, or smoking, use of tobacco, smoking, they all end up with gum disease. That's another side effect of having these chewable form of tobacco or smoking. Number 3 is some people, by improper brushing also, they could damage their gums. So be careful, don't brush your teeth and gums too hard in a horizontal way. That could actually damage your gums. You could have gum recession and your teeth enamel could be exposed. You could have sensitivity. So take care of these other things, but most important, don't miss out on the symptoms, which is bad breath, bleeding gums, and when you eat, if there is some bleeding that comes onto your teeth, or when you brush there is bleeding, don't ignore such symptoms. See your dentist immediately. Stop the disease right there and then, so that it doesn't progress further and cause more damage. If you think this information has been useful for you, if you think that this is some of your friends, maybe some of your relatives have such disease where you are not able to tell them that they have a bad breath or they have such disease where there's bleeding gums, do share this video with them. Do like our video, do share this video, and do subscribe to our channel so that you'll be able to hear more about such myths and tips that will be helpful for all of you.